So vacation for me began when I went directly to the Philadelphia International Airport from the studio where I deliver my CNN program every Saturday. I went right from the studio, to the airport in my sport coat, and that is the way in which I headed off to vacation. My last official act was a work act, a commentary that I delivered on CNN in which I said that it was time to increase vaccine mandates, especially for government employees, including the military. And, like 10 days later, that doesn't sound so revolutionary, but it kind of was when I said it in my commentary. In fact, we had a survey question on CNN on my website, but from the CNN audience that day, in which I asked whether it was time for President Biden to impose vaccine mandates, including on the military. We had more than 20,000 people, nearly scientific, as I like to say, cast their ballots, and 90% agreed with me that, yes, it was now a time for mandates. And indeed, by Monday, and I had called him out on the air, I'm not taking credit for it, but I'm factually noting that I had called out on air Mayor de Blasio and also Governor Newsom, whom I did not call out. But by Monday, after my Saturday commentary, both New York City and California had announced that employees would have to be vaccinated or tested regularly. This, on top of the fact that already in the private sector, many employers demanding that employees be vaccinated. My own, two of them, employers, CNN, the law firm where I'm associated, Klein and Spector in Philadelphia, have a mandatory vaccination policy. And when I was on CNN and delivering this commentary about the need for vaccine mandates, I said, look, the White House, they watch this show. I don't know if the big guy is watching at this moment, but they will see the result of this survey question, the question asking, do we need more vaccine mandates? And so almost immediately thereafter, on Monday brought the news of de Blasio and Newsom, and very earlier in the week also came the news that there would be some word from the White House and that President Biden would be stepping up pressure on federal employees. And that came on Thursday. And I don't think that he went far enough. I think that saying you need to declare your status, I mean, this is the simplified version of what the federal government is doing, saying that you need to declare your status, you're vaccinated or you're unvaccinated, and either then be vaccinated or subject to frequent testing and work and travel limitations. That is not the same thing as a mandate. And then the Pentagon pretty much announced the same thing on Thursday for the military, and I think it's deficient. I mean, there are 1.3 million active duty military, and in round numbers, as of a day ago, when I put together notes, 64% fully vaccinated in the military. That's better than the roughly 60% of all Americans who are over 18 who are vaccinated. So the military exceeds our national average, but it's still not enough. Not where from boot camp onward, you're required to get vaccinated from or against more than a dozen diseases. My point is that President Biden could have gone farther. So too the military, they probably feared backlash. In fact, almost as soon as President Biden and the White House tipped their hand that they would be upping their game on vaccine mandates, there were responses from unions representing teachers and police and postal workers, all calling for negotiations on this subject. But at least, I'll give him credit, headed in the right direction. But the federal government should have a vaccine mandate. Also, while I was away on vacation, came that CDC announcement of new recommendations that vaccinated Americans in hotspots should resume wearing masks indoors. I think that the announcement was both muddled and confusing. The CDC move was based on the belief that people with a breakthrough virus, meaning that they're vaccinated, but they still get it, can be contagious even if they are asymptomatic. This, despite the fact that nobody disputes that the vaccines, I guess I should say, prevent severe illness and death, and that people who are vaccinated rarely end up in the hospital. So now, fast forward, all of that is taking place in the world of COVID. Fast forward to our last night of vaccination. It's Friday night, and we have, come out of the Sonoma Hills. And now the final night before coming home, we're in a Silicon Valley town with a progressive reputation, sort of place that outpaces the national average on higher education, voting for Democratic candidates, and probably sushi consumption. Okay. That kind of a place. In fact, I looked it up. Because I thought, I'm going to stereotype if I portray it that way. And indeed, the county where we were now resting our heads, Santa Clara County, has the most fully vaccinated people of any larger county in the entire nation. Or so I was told by KRON, although they didn't offer it on a percentage basis. But okay, still, it makes my point. And not to stereotype, I shouldn't, because I'll tell you what, something else that I recognize getting undue attention. When I mention the unvaccinated, what are you thinking? You're thinking white, you're thinking rural, you're thinking Trump, you're thinking evangelical Christian, you're thinking political conservatives. And that's largely true. But the Times had great coverage saying there really are two categories. There's that category of vaccine resistant. There's a second category who are largely urban, largely young, largely Black and Latino, and largely Democratic in their political leanings. I mean, there are 90 million Americans eligible right now who have not been vaccinated. And yeah, they're the problem. And the president is right when he calls it a pandemic of the unvaccinated. So back to Friday night now. My wife and I get on a hotel elevator. We are vaccinated. We are unmasked. And there's a man, we're on the 4th floor. So, we get on, we've got to go from 4 to 1. And there's a man on the elevator already. We get on with him. He is masked. He's in a sport coat. He's got a travel bag and briefcase, a rolling suit. He looked like I look when I'm traveling. He had the travel suitcase and he had a briefcase attached to it. And he's masked. And when the elevator stops, we get off and we go our way and he goes his way. And my wife suggests to me, we should have been wearing masks ourselves. And I say, but we're vaccinated. And she says, yeah, but it's a respect thing and we can still spread it. And I say, okay, but what are the odds? And now we walk outside, and while most, again, I said Santa Clara County, I've not identified the town for reasons I'm not sure why I haven't identified the town. I'm home now. Anyway, we walk outside and most people on the street are unmasked, but several are masked. And yes, stereotyping again, but I looked at them and I thought, these people, I'll bet, are vaccinated in this town. They're not the ones causing the problem. If I go with that first category that the Times identified of the two categories of people who are causing the problem, I'm now looking at folks who are white, but they're not rural. I doubt many of them are evangelical Christian. And frankly, I doubt that many of them are Republican. Nor are they people of color and in the inner city. Maybe like my wife, they think it's a respect factor. To me, it's more of a social statement. That's how I interpreted their masks. It's kind of a prophylactic measure that is largely unnecessary. So that's sort of the vignette of having encountered the man on the elevator, sport coat, travel bag, masked. Now, the following day, we head home. And in the print edition of the New York Times comes the news that here's what the headline said: immunized people can spread the virus, CDC reports. And I look and I say, look at that headline and I say, wow, maybe I should have had the mask on in the elevator last night. Oh, but wait, there's a subheading, and the subheadline on that same Times front page story says, cases among the vaccinated are relatively rare and tend to be less severe. And I see the subheadline and I say, aha, see, I didn't need to wear a mask on that elevator. The corresponding story, written by Apoorva Mandavilli, who's been a guest on this radio program, has a little something for either perspective on the mask wearing issue. In other words, it says fully vaccinated can spread the virus just as readily as the unvaccinated can. Like, ooh, wow, I guess I should have been wearing that mask on the elevator. Oh, but wait, the story also says infections in vaccinated people are comparatively rare. Huh. I guess it was okay not to be wearing a mask. And then there was more to the Times story. The Delta variant is as contagious as chickenpox, it said. Oh, yikes. Hey, those of us who are vaccinated, we better mask up. Oh, but wait a minute. The story also said breakthrough infections are infrequent. According to the Kaiser Foundation, less than 1%. Hold on, less than 1%? And yet I'm still seeing that headline in the Times? You probably know by now that causing much of this whiplash in the time that I've been off air is what happened in Provincetown. Provincetown or Provincetown? Provincetown, right? Provincetown. Barnstable County. Barnstable
County, yes.
Barnstable County. So July 4th, there was a gathering that quickly mushroomed into an outbreak. In other words, on July 3rd, there were no known cases in this area. Then July 4th, 60,000 partiers show up. For me, I think Lincoln Financial Field, which is where the Eagles play. Like that many people descend on this one town. And by the 10th of July, the health officials are noticing an uptick in cases. By July 17, they've got 177 per 100,000 people. The latest figures that I saw, 900 people had the virus across the whole county, Barnstable County. Now, here's the kicker. 74% were fully immunized. In other words, they were fully immunized and they still got it. Holy crap. I read that in the same Times story, and now I'm saying, I should have been wearing that mask on the elevator with that man, with my wife. Oh, but hold on. Because the CDC is reporting that 97% of people hospitalized with COVID, 97% are unvaccinated. I'm not the only one confused by all this coverage and the messaging. Brian Stelter reported from his Reliable Sources newsletter just 2 days ago under the headline, "You're Doing It Wrong." He had this. Unfortunately, in some cases, those outreach efforts might have occurred too late. The New York Times, for instance, tweeted early Friday morning. This is a tweet that mirrors the coverage that I've just summarized for you. The Delta variant is as contagious as chickenpox and may be spread by vaccinated people as easily as the unvaccinated. And then Stelter says, Ben Wakana, a member of the White House Rapid Response Team, responded bluntly, all caps, vaccinated people do not transmit the virus at the same rate as unvaccinated people. And if you fail to include that context, you're doing it wrong. He goes on to say, Stelter does, that the Washington Post similarly had a headline. CDC study shows 3/4 of people infected in Massachusetts COVID-19 outbreak were infected. And then Matthew Getz commented, please don't do this. Provincetown has one of the highest vaccination rates in the country. As vaccination rates increase, the percentage of cases that are in vaccinated people necessarily increases. The Post's headline was later updated to note that in the outbreak, few required hospitalization. What am I suggesting to you? I am suggesting to you that the data is being manipulated for partisan and sales purposes. I mean, I'm trying to do the right thing. I'm trying to be responsible. I'm trying to decide whether I owe the guy in the elevator a mask on my face. But what occurred to me as I'm watching this unfold and I'm thinking about my own real life travels and experience, imagine that I'm someone, I'm not, imagine that I'm someone looking for an excuse just to tune out and just to not wear a mask. They're making it easy for me with all of this mixed messaging and manipulation that then takes place by partisan sources and some in the media. Mike Allen. I mean, it's not just me like thinking like, where the hell lies the truth? Mike Allen, who does a nice job for his daily newsletter, had this yesterday, on Sunday. The past 5 days were a mess. On Tuesday, the CDC updated its guidance to say vaccinated people in hotspots should wear masks in indoor public settings without an easy, definitive way to know if you're in a hotspot. This was a reversal from the CDC's announcement on May 13, 75 days earlier, that fully vaccinated people should shed masks in most indoor settings, which President Biden called a great day for America in our long battle with coronavirus. And then on Thursday, the Washington Post obtained a CDC desk that included the eye-opening line, Delta variant as transmissible as chickenpox, and then goes through the remainder of what happened in the week. The alarmist coverage then irritated the White House, yada, 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 some of what I've already told you. Now we're all left wondering how to resume our lives against this backdrop. Some say that those who are vaccinated, need to mask up. I saw that while I was away, an announcement was made that Broadway will reopen, but all theater goers must be A, vaccinated, and B, wearing masks. Well, what about when we're just out and about and not business invitees in a Broadway theater? I need to make this observation and then try and bring this to some semblance of conclusion. Many of the people who object to government intervention, the don't tread on me types who are one category, not all of those who are unvaccinated, they are now bringing about government intervention. In other words, if you would be a responsible citizen and get vaccinated, you wouldn't have to worry about Big Brother doing it on your own. You wouldn't have to worry about Big Brother or your employer telling you what you're going to do. You're the ones who are necessitating the mandates that I'm advocating. That's what I wanted to say. Now, what about the guy on the elevator? I said at the outset that there are no absolutes, but here's what occurs to me. And you tell me if I'm mistaken in this bottom line assessment. I'm vaccinated. It's very unlikely that I'm going to get COVID-19. If I do get a breakthrough, the chances are I won't have symptoms. If I do get a breakthrough, there's a small chance that if I do get it, I will transmit it. Okay, do you agree with me so far? It's unlikely I'll get it. If I do get it, chances are I'll be asymptomatic. If I do get it, there's a very small chance that I'm going to transmit it. Having said this, I might transmit it to an unvaccinated person who has chosen to remain unvaccinated. This will sound harsh. For them, I say too bad. If that unvaccinated person is a child, then I feel sorry for them. Rare, however, that they will get seriously ill. I come back to the same category of person that I was worried about before I left for vacation, the unvaccinated who is immunocompromised. That's the unfortunate circumstance that I'm worried about, which would be made even more rare that they'd get infected if everybody who could make a choice to get vaccinated would simply get the vax. What do I owe the man on the elevator? My conclusion is I owe the man on the elevator the same thing that he owes me. I owe him the respect of making an intelligent decision to get vaccinated. I owe that to him, and he, so long as he's not immunocompromised, doesn't have a medical condition that precludes it, or I guess I need also say a sincerely held religious belief. Sorry to have such cynicism in my voice. I'd like to know, what is the religion that says don't get vaccinated? Nobody's told me that yet, but I owe him what he owes me. He owes it to me to get vaccinated, and I owe it to him to get vaccinated. And I am.